This is the 2C mini lecture, and we'll look at the chapter 13 on professionalism. Professionalism is essential for healthcare workers, and yet it's very difficult to define. It consists of so many characteristics and behaviors, and we're going to run through them so you'll understand how much it encompasses. Essentially, it's a dedication to doing the best and maintaining high quality service, but it includes things like compassion and empathy, showing concern for others. Empathy, of course, is being able to understand another person's thoughts and feelings, understand what they're going through. It's your attitude, how a situation is viewed, whether it's a positive attitude or a negative one. Are problems struggles or difficulties, or are they opportunities to learn? To demonstrate a professional attitude, you need to approach work positively, be committed, recognize how important you are to patients' care, use an objective approach, solve problems, and see them as opportunities for positive action, and to be self-disciplined. True or false? Primary focus of healthcare professionals should be the welfare of their patients. That is true. True or false? A patient who is being difficult or rude may simply be reacting out of fear or pain. That is true. Empathy helps you understand that. Professional behaviors are important because each individual represents the facility, and your actions and attitudes influence patient satisfaction with care. You should never, ever complain to patients about work. Jamie believes his supervisor does not listen to him and deliberately makes the work unpleasant. Jamie should discuss his problem with who? The supervisor. Problems should be discussed with the supervisor, even if they involve the supervisor. If you're having problems at home that are worrying you, it's a good idea to share them at work so your coworkers will understand. That is false. Keep home at home and work at work. Professional behaviors include being dependable, completing your duties as assigned, being flexible, accepting differences, and treating everyone with courtesy and consideration. It's communicating well. As we mentioned, keeping personal problems separate from work, being well organized, planning ahead, and behaving ethically. It's important to conduct yourself calmly as a professional. Be a good role model for health, and set professional goals, striving for improvement. Of course, healthcare involves technical skills. You need to understand your work, to observe, to listen, to consult an employee manual or ask questions when needed, and to perform your work accurately and neatly. It also requires that you dedicate time to acquiring new knowledge and skills. True or false? It is not necessary to understand why you are performing a procedure as long as you can do it well without making mistakes, and that is false. You need to understand the theories. You need to understand the why. True or false? If you are asked to do something by your supervisor, you should never question whether directions are appropriate. That is false. It is appropriate to ask for more information. You should be thinking about what you're doing and question directions if they don't seem right. Professionalism also includes appearance because this influences a patient's opinions about care. It's an outward sign of professionalism. It's generally conservative because extremes can undermine patient satisfaction. So you need to practice personal hygiene. You need to pay attention to dental hygiene. Avoid perfumes. They can irritate. They can cause breathing issues for some. Avoid extreme styles and consider safety. Can perfumed products trigger asthmatic attacks? That is true. Professional distance means maintaining a healthy balance in professional patient relationships. You need to care, you need to show empathy, but you shouldn't be depending on your patients for friendship and approval. That actually can get in the way of achieving the patient's healthcare goals. Is it acceptable to develop a friendship with a patient? True or false? False. Not in most situations, for sure. It's not a good idea. Professionals handle difficult situations in an objective, caring way. They have a good understanding of their own behaviors, and they separate fact from emotion. What does objectively mean? Considering the facts. Professionals also need to accept criticism. Criticism can help you learn. You need to react gracefully and evaluate the information, and if appropriate, then use it for self-improvement. Professionalism reaches outside of the workplace. Remember, you represent your profession both on and off the job. So you need to avoid inappropriate behaviors and be very careful with social media not to post photos of those inappropriate behaviors, not to post negative comments and complaints, be rude or bully. Leadership is part of professionalism as well. It's encouraging people to achieve common goals. Leaders have a high level of competence, they are committed to quality service, and they're willing to recognize and support the work of others. Leaders are dedicated to high standards. They believe in change and improvement, and they serve as an example, and they're able to communicate effectively. Which of the following is an example of a leader? An employee who inspires his coworkers to work together. Very good.